So here we are at the M.A.R.C Institute in Miami, and I have here Dr. Scott Echols, who is a world-renowned veterinarian anatomist, among many other things, in terms of an innovator in our field. And he's developed a contrast agent as well as a preservation agent that can be used within human cadavers that can actually preserve these cadavers and allow us to study them in many different ways. And I just wanted to ask Scott a few questions while you're here.
Sure, absolutely.
One of it would be, what inspired you to develop this type of technology?
Oh, it's a great question because I was driven by the need and also the concern for current products that are out there. So the need is that we really need better means to visualize this anatomy, to preserve the anatomy in a way that mimics lifelike situations. And again, our ultimate goal is how do we see this stuff, study it, and better understand it so that we can understand these diseases better and provide better treatments and ultimate patient outcomes. So I was also quite concerned about the products that were out there. So for example, contrast agents, a lot of them are highly toxic. And I mean to the environment, to the handlers. Even people say, well, they're only going in deceased subjects. Well, no, you're still putting them out in the environment. So some of them were soluble metals and other things that were either, they're so toxic, they're difficult to handle, but also the way they interact, you have very little working time and they're not very versatile in terms of what type of imaging you could use.
Right.
So I really wanted to change that. And the same thing with preservation agents. A lot of people are familiar with formaldehyde and phenol and these types of toxic compounds. And I want to get away from all of that, literally all of it, and find an entirely unique and new way to preserve tissues. And this is a water-based system.
Right. I mean, all that makes sense. I can remember when I was in medical school and how we learned anatomy. And from what I've seen and the product and let's say the outcome of what this preservation agent has allowed us to do is remarkable, and I credit you for that certainly, and I think it will certainly lead to many more discoveries and better training in our health professionals and in many other fields. I wanted to ask you related to let's say research, like research from a standpoint of just normal human anatomy and pathology when it occurs, and some of the discoveries, let's say, that you feel may be able to be made because of this technology.
Yeah, so that's another very exciting thing. And we've actually kind of discussed a lot about research because, you know, the way research is done now, either you have animals, and a lot of people are trying to get away from animal research because you have to euthanize these animals, or you're using models that are not the real thing. So they can be plastic or silicone or other types of models, or computer modeling. Or then you're using tissue that's not really lifelike. Maybe it's stiff, or maybe it's doesn't retain the normal characteristics. So the ability to use not only real tissue, but lifelike tissue, meaning the physical properties are lifelike, that then opens up the door for all types of research projects. Certainly. And now you can start to study things that you simply can't ethically do on living tissue or animals or so forth. And it also means it allows you to test as though this was a living human. So we can actually do these things, and we can test new surgical procedures that might be risky in the OR. But what if we develop it before we get to the OR stage? Right.
I mean, it's better to learn. It's better to learn in a way where it's in a safe environment, let's say, and it's really the true gift that the people give us when they donate, let's say, their bodies to medicine.
Yes.
That somebody else will benefit from that in the future through either training or a better understanding. Definitely, the tissue quality that I've noticed in these specimens is wonderful. I mean, it is as if I'm doing surgery in the operating room, which is amazing.
Yes.
One of the other things I found fascinating was even the functionality of some of these organs post-mortem with your agent are still functional. Like even explain that, like the lungs and the kidneys, and it's amazing.
So because this is a water-based preservation system, totally different. So we are preserving the function of many of those tissues. Now, keep in mind, there's no brain tissue, there's no
Right.
neural activity.
Certainly.
However, some tissues, like you mentioned the kidney, it's a filtering organ. So if the kidney was not in failure at the time of death, the kidney still functions. We're talking about weeks, months post-mortem. So
Right.
we can actually produce a filtrate, if you will,
Right.
out of there. I wouldn't call it urine, but it
Right.
is going to be something, either we're getting fluid coming out. If the lungs were functioning prior to death, and we pump in real blood, we actually get oxygen exchange. So we can take a
Unbelievable.
pulse oximeter,
Right.
and we can get real readings peripherally, in different parts of the body, and actually get pulse ox readings.
Right. And I'm sure there are many other things too that we haven't even thought about or discovered. I mean, this is truly just the tip of the iceberg.
Absolutely, and we're doing all sorts of different imaging studies and all that, and when we're pumping blood and you're doing imaging, you actually get to see how that contrast agent or whatever you're using, you actually see how it interacts with the tissues.
Right.
And it's really like when you see the blood vessels and you see the contrast go through it and you see it hitting different organs, not only are we saying, oh yeah, we are getting contrast through, but you're actually seeing how blood goes from A to B. Like let's say we have a normal tissue.
Right.
Let's just say you're doing contrast into the kidneys and then you're doing abnormal tissue, maybe there's cancer. How does that blood get diverted in or around the cancer before it gets to our normal tissues? That's just one example.
Wow, that's great. I would like to ask you back sometime if you would
Okay.
like to come back
Absolutely.
to my. Oh, great.
Yeah, thank you.
Yeah.
Appreciate it.